Can bladder training techniques reduce stress-related urgency? Imagine being able to take control of those sudden urges to go to the bathroom, especially when stress makes things worse. Bladder training is a safe, non-invasive way to help with that. It works by teaching your bladder to hold urine longer and respond less reflexively to stress or urgency signals. The process starts with keeping a bladder diary to understand your current habits and how often you feel the need to urinate. Once you have that information, your healthcare provider might suggest setting a schedule to urinate at fixed intervals, slightly longer than your usual frequency, even if you do not feel the urge. For example, if you normally go every hour, you might try every hour and 15 minutes. Over time, these intervals are gradually increased by about 15 to 30 minutes, helping your bladder stretch and hold more urine comfortably. During this process, techniques like distraction, relaxation, and pelvic floor muscle exercises, commonly called Kegel exercises, are very helpful. These exercises strengthen the muscles that support your bladder and can reduce involuntary contractions that cause urgency. Combining bladder training with pelvic floor exercises has been shown to improve symptoms significantly, especially in cases where stress or anxiety worsens urgency. The goal is to recondition your bladder so it responds less to stress and urgency signals, which can be especially beneficial during the day. With patience and consistency, many people see improvements within a few weeks to a few months. It is important to remember that bladder training is a lifestyle approach that promotes better urinary control without medication or surgery. It is especially useful for managing overactive bladder symptoms, which often include stress-related urgency. However, if your urgency is caused by a more serious condition like bladder cancer or other bladder diseases, it is essential to seek medical advice. Bladder training can be part of a comprehensive treatment plan but should never replace professional diagnosis and treatment for underlying health issues. Overall, bladder training techniques can be very effective at reducing stress-related urgency by increasing bladder capacity and strengthening control muscles. When combined with behavioral strategies and guided by a healthcare professional, these methods can improve your quality of life and help you regain confidence in your bladder health. Remember, every person is different, so personalized advice from your healthcare provider is always the best way to ensure safe and effective management.